All right, is that better, Jamie? I don't know what happened there. Anyway, as I always say, please remember that I'm not giving you medical advice. This is meant for general information and educational purposes only. Let's see, not all that much to really get to today. The one here, I'm going to talk about one thing that I got as a question, not through this, but a question I got from one of the girls on a dance team that I take care of, and that was the difference between a herniated disc and a bulging disc. So the discs, this is the lumbar spine, you got the vertebral bodies there, and then the discs are in between. Now, we're going to look at it from the back because that's typically where you have the herniated disc, but I'll show it to you from the front because you can't really see it. A herniated disc, think of it as sort of like a jelly donut, okay? You've basically got where you get a rupture of this outer lining, and then all the inside fluid, the jelly, so to speak, leaks out, and it can put pressure on the nerve roots that come out at that level, and that's what causes the pain that radiates down your leg. If it's in your neck, the pain that radiates down your arm. Whereas a bulging disc, a lot of times, is either just pressure on this outer annulus, or you can actually get a fissure or small tear in the annulus, but none of the fluid leaks out. Typically, bulging discs, this is not perfect, but bulging discs typically cause pain just in the lower back, sort of in the muscles along the side, whereas a herniated disc causes pain that radiates down the leg, pain that, again, with like what's called a straight leg raise, when you lift your leg off the ground, it shoots pain down into your foot and toes. Numbness, tingling, sometimes even weakness can be a really, really tricky problem. Typically, that's treated with rest, things like physical therapy, sometimes anti-inflammatory medications or oral steroids. Sometimes it's a steroid injection into that area to try to decrease swelling around the nerve and get rid of those symptoms. And then, sometimes it's surgery where part of the disc that's extruded is taken out. All right, what else can we talk about? Anybody have any questions? Otherwise, we are going to make it a very, very short Friday, which is good because I got some things I need to do as I prepare for my trip. Just as I said, if you watch Better Than Ever live on Tuesdays and Thursdays at 5 p.m. Eastern, I said I am gone next week. I am traveling for 4 or 5 days, so I will not be here, but I will be back here next Friday for Ask Dr. Geier Live. But I will miss Tuesday and Thursday, and then we'll go from there. Get back on track. Definitely make sure you check out Better Than Ever Live. It's where we talk more health, wellness studies, exercise, sleep, aging, nutrition, those kinds of things. If you want to live longer and feel better, that show can teach you how to do it. Yesterday we talked about whether running makes knee arthritis worse and a number of other studies. We've talked recently about senolytics, and we've talked about supplements for arthritis. We've talked about whole body vibration. We've talked about cryotherapy. So if you like that kind of thing, definitely join us Tuesdays and Thursdays, 5 p.m. Eastern Time, not just here on YouTube, but also on Facebook and Twitter. You can also check it out as a podcast wherever you get your podcast. That's Better Than Ever Live. So definitely do that. If you do want to see me as a patient, you have an orthopedic problem, and you want to see somebody that isn't going to just say, hey, you need surgery, or let's just do a cortisone shot, but really talk to you about all kinds of options, I would love to help. You come see me in Charleston, South Carolina, which is one of the more amazing parts of this country. Most people, just about everybody I know, loves it, but we can set that up for you. Go to my website, drdavidgeier.com, which should be in the description below. Go to the Work With Me tab up at the upper right corner of the homepage. You'll see a drop-down menu for the contact page. There'll be a little form you can fill out that gets to my assistant, and we can help set up an appointment with you. All right, one from Mary real quick before I go. Fractured thigh over a year ago, trouble building strength. What's a good exercise? So you're wanting to try to build up both the quads and the hamstrings. So you kind of look at it together. I'm a big fan early on of closed chain exercises more than open chain. So closed chain means your foot is fixed to either the floor or a surface like the leg press plate. So squats, leg presses, if you can't do heavy weights, that's okay. Even body weight squats can be good. Sometimes wall squats can be good. But then once you start to develop some strength, I believe opening up to more open chain exercises, your leg extensions, your leg curls, lunges can be really effective. So there's a lot of factors. That's kind of where I'd start. Other things when you think about ways to recover from injury and get strength back, one of the things that I've kind of been thinking a lot about, I haven't really explored it with any of my patients yet, but there are physicians that are big believers in using either HGH or a growth hormone releasing peptide to help bring back muscle back after surgery and after an injury. So that's something else I think that may be on the horizon as far as recovery from orthopedic injuries. Jamie is having pain in her shoulders and back, and if I remember, that was a clavicle fracture. And I apologize, I just forget people and what their injuries are. Yeah, that's another area with the shoulder. It can be a lot not getting full muscle strength back. It can also be maybe not getting all the motion back. As far as other causes of pain, it'd be one of those things I'd have to just see it, examine kind of what it is. But those are the two things. Not getting full shoulder motion back is a real problem after surgeries of the shoulder and shoulder injuries. It really starts this downhill cycle. It gets tight, then it hurts as you try to do it, and it gets tighter, and it's this pretty quick downward spiral. Not getting all the motion, all the strength back tends to put stress on the area that was typically injured. So that is one of the tricks there. All right, like I said, really quick show. Sorry for the earlier audio problems. I'm not 100% sure what's going on with my restream today. That's why the video picture looks kind of funny, but very, very excited to be here. I will be back a week from today, April 22nd, 12 p.m. Eastern Time for Ask Dr. Geier Live. No Better Than Ever Live next week, but we will get back on track the week after. Thank you so much for joining me. Have a wonderful holiday weekend, and I will see you very soon. Take care.